And today we are very pleased to have Dr. Eric Wong present on the Connecting Ontario platform. This is the last of our virtual care webinar series. And Dr. Wong is a geriatrician and clinical associate at St. Michael's Hospital. He is also a PhD candidate in the clinical epidemiology program at the University of Toronto. So Dr. Wong, thanks for joining us, and I'll turn it over to you now.
Thank you, Alikia. So I'm going to share my screen. Okay, can you guys see this? Okay.
Yes, we can.
Okay, perfect. Welcome everybody. So today I'm going to talk a little bit about Connecting Ontario. This is an idea that came from Dr. Barbara Liu, the RGP Toronto director. So we use Connecting Ontario every day for our geriatric assessments. And so this is just sort of my approach to it. I don't think there's a right or wrong approach, but just some tips that I have. And for sure, if there's any questions that you guys have on this, just let me know. So the goal of, the purpose of this talk is that virtual care is sort of here to stay. So we need to learn ways of gathering information efficiently using, without being physically at the chart. And so one of the things that a comprehensive geriatric assessment needs is it needs a lot of details. And Connecting Ontario Clinical Viewer is the right tool for this. So this is an inter-facility portal. It provides information on medications, lab results, imaging, consultation notes, LIN referrals, and also visit history. So it's pretty comprehensive. Oh, we're going to start with a poll. So, Sarah? Okay, so the question is, how often do you use Connecting Ontario? I don't use it. I use it rarely. I use it for some assessments, for most assessments, or for all assessments. So you just, I think you just like click an option and then it submits, and then we're going to see the results after you all vote. Oh, okay. So the results are 52% say they don't use it, 19% uses it sometimes, 14% uses it most times, and 14% uses it for all assessments. So it just gives me a gauge as to what people do. So the talk is assuming that you have access to Connecting Ontario. We'll talk about if you don't have access, what you're going to do. But the assumption is that you do have access. So for those who don't use it, we can ask me later in the talk if there's anything that I can help with in terms of access, but it's that the accessing it is a separate process. But if you do have access and you don't use it regularly, then this talk may be helpful. All right, so our objectives is to understand how to use Connecting Ontario to gather information for a geriatric consultation. We'll understand where to find the information and also understand the limitations of the system. So the first step, how to launch Connecting Ontario. So usually when you're working in a hospital, your hospital electronic medical record system will have a direct link to Connecting Ontario. So obviously it's different for every site. So you'll have to ask your peers, your colleagues, or your IT department if there's access for your site, and also where the access is if you don't know. But I think for some of you who use it, you know how to access it. The good thing about launching it within your hospital electronic medical record system is that it goes directly to the patient's chart. So you don't have to look up the patient on Connecting Ontario. It just launches you directly into their chart. Now, the other way to launch Connecting Ontario is actually external. So you can use it externally outside of a hospital network through eHealth Ontario. I'm not sure how many people actually realize this, but I actually went through the whole process and got an external access to it. This is good because you can access it anywhere as long as you have internet. You don't need to be inside a hospital. You don't need to use Citrix or whatever intranet system you use. You can use it anywhere on any patient in Ontario. And you use their health card number to look it up. So this is very useful, especially if you're in private clinic. So if you have an outside clinic that you use, or you're working long-term care, for example. Now, I think most long-term care homes don't have routine access to Connecting Ontario, but it's definitely very helpful. I have been doing long-term care consults prior to COVID, and I would actually physically go to these long-term care homes and see patients. So when I'm there, I would access Connecting Ontario via the eHealth Ontario website. So the way to do it is to use this link here. You can also just Google Connecting Ontario, and this link will be the first hit that comes up. On that page, you'll be able to log in to Connecting Ontario, but if you don't have access, it also provides a link for you to request access. So you can also request access from it, or you can log in using the same website. The requesting access, so for you, like, most of you will not be onboarding your entire hospital. Hopefully, whichever hospital you work at will already have access. But if you want to onboard your entire hospital, like, your hospital doesn't have it and now you want it, then it should obviously go through your managers and the IT department. But if you want to do it individually, then you can request it here. Now, I'm not sure in terms of credentialing, like what types of health professionals can actually have access. We obviously, as physicians and nurse practitioners, I know that they will have access, but you use your One ID to log into it. Within the hospital EMR system, I think all health providers should be able to access it, but definitely outside it may be more restrictive. So you would have to inquire about that. I actually don't know. If you are a physician, then you can email this person. Charles Lee actually provided us with the screenshots that you'll be seeing on the slides today. So he's very helpful. So this person on Ontario MD helps physicians on board, whether you're outside or inside the hospital system. Okay, so what is the first thing that comes to your mind when you launch Connecting Ontario? So this is obviously a joke for people who use Connecting Ontario. I originally had a slow traffic sign and Sarah changed it to a turtle. It means the same thing. It tends to be slow. And it can be buggy as well. I think it's a limitation of their system. And I think that in the comments that were sent before the talk, there were some comments on how the system is very slow. It's breaks down. It sometimes doesn't load. Interestingly enough, this morning I did a virtual clinic and I tried for half an hour to get the medication list from Connecting Ontario and it just wouldn't load. And then I also asked our clinic nurse Frances, and turns out she couldn't get it either on a different system. And so there are some issues with reliability. I find that if you go with a direct link to Connecting Ontario outside of the hospital network, sometimes it's more reliable. The only issue with that is that it tends to log you out very quickly. For security purposes, I don't know, within 5-10 minutes, if you don't use it, it just logs you out and makes you log in again and again. And often when I do consults at long-term care, I should log in 10 times during the day. It's annoying, but for security purposes, it's understandable. But if you don't have external access, then you're stuck with the hospital access, which is fine. Other limitations of the system, so not all data types from all hospitals are included. You can go to this link here. It's also available from that Connecting Ontario, eHealth Ontario website about the data summary, which data types are available. So not all hospitals in Ontario actually upload all of their data. I think laboratory results are usually pretty comprehensive. Imaging is pretty comprehensive. Medications are limited to ODB records, so outpatient records, if they're funded by ODB or Trillium. And For notes, so consultation notes, inpatient notes, stuff like that, not all hospitals would have it. So it is a limitation. Just because it isn't there, it doesn't mean that it's not actually available, but you would have to go through other means of getting those notes. Right, and then so you'll have to get individual, if you're from outside of a hospital system, you do need to get separate access. All right, so we are going to start by looking up a patient's record. And again, we talked about, like, if you're from a hospital, just launch it from your EMR system. And if you're outside, then you log into eHealth Ontario and you log in. So this is the interface that comes up. Now, don't worry, this is not a real patient for privacy. This is a simulated patient, hence these screenshots are not mine, but they're from Charles. So the way you look for a patient is to search for a patient. All right, so you can search for, so even if you're in the hospital system, say, and you're, say you have a consult, and that patient hasn't been registered with your hospital EMR system yet, you can actually still look up their information before they're registered, before they have an MRN, by going through another one of your patients, going to Connecting Ontario for that patient, and then search for a patient. So when you click search for a patient, it pops up this little window, and in this window you can search 3 different ways. The most reliable way is to search by their health card number. So you enter in their health card number with no spaces and no version code, and then it will give you exactly that patient that you're looking for. If you don't have that, you can search them by MRN. So it will actually let you look up the whatever hospital, if you know that they're, say, from a certain hospital, like a St. Michael's Hospital, and you know they're St. Mike's MRN, you can look it up. I find that it's less reliable. And in the advanced search, I think lets you look it up by a different demographic information, which is even harder. Basically, the easiest way to do it is by health card number. So once you look it up, then you end up on this page. This is their launch page. So you notice here in the corner, right here, yep. So there is, you can use this double arrow sign to actually shrink this, this top part here. And this is a timeline. When I did the training with connecting on with the Ontario MD folks, they said, "Oh, look, the timeline is very helpful. You can sort of see what kind of stuff they had." I find it very cumbersome, and I find it a little bit annoying because it takes up a lot of screen real estate. I think somebody also commented that, how do you like make it more accessible, because this thing is like this part here, this time is taking up a lot of space. So you can shrink it. So if you click that arrow button, then it just minimizes it, and then you have more space to look at the stuff below. By default, the interface will only give you results for the last 30 days. So now this is not the default. So Charles already went into a custom date range here, but when you launch it, it'll default to 30 days. Okay? So you're going to only have the last 30 days. But of course, if you're doing a geriatric assessment, you're going to want more. So the way to do it is in this top bar, just above the timeline here, there's buttons for 3 months, 6 months, 1 year, right? So sometimes when you press for time, you might just click 1 year. It loads faster when you don't go that far back in time. But often when I see a new patient for geriatrics, I always go back because I want to know all the notes. So typically, I go back to 2016 or 2012. Why do I pick those years? Because, sorry, it's not included. When you click this calendar icon here, there's a preset like dates that you can go back to. And it's easiest to click 2016 because it's the farthest one from the first little box. Then you have to click an arrow to go back more. So you click another arrow, you go back to 2012, click another arrow, you can go back to like whatever, 2006 or something like that. So the further back you go, the longer it takes to load, but the more details you get. So you click go, and then it gives you all the information after it buffers and tries to get all the data. We're going to launch a second poll here to figure out how far back you look. So obviously this is only for the people who use Connecting Ontario. For those who don't, it's okay, you don't have to vote. So typically for, say, a new patient that you see, how far back do you look on Connecting Ontario? Do you look in the last 30 days, 6 months, 1 year, 2 to 3 years, 4 to 6 years, 7 to 9 years, or you're one that just goes back to 1996 and you try to pull all the data? No, I don't think it actually goes back that far because the hospital systems actually needed to have available, like, they needed to have the data available for upload, and some of the older systems will not be able to upload. So you can't really go back that far. Okay, so this is good. The results are 14% said 6 months, 7%, one person said 1 year, 3 people said 2 to 3 years, 3 people said 4 to 6 years, and 1 person said 7 to 9 years, and then we have 4 people saying as far back as the record goes. So a very geriatric assessment crowd here. Thank you. So that sounds about right. Now, why do I ask that question? Barb and I were talking about this, I forgot, it was a year or 2 years ago. And we were just like chatting about like, what is our legal obligation? Like, are we gonna, if we don't go far back to like, 1996, 2002, are we gonna have issues when we miss stuff? Because, for geriatrics, we want to be pretty comprehensive. And so we didn't have an answer. So we went to our legal representation organization at CMPA, and we asked them this question because Connecting Ontario is slow, it's buggy, it doesn't always work. And if you want to go all the way far back in time, sometimes it takes forever, but you might be doing that chart review for like half an hour, and you don't really, sometimes you don't have that much time. So we asked them, like, what is our legal obligation? Now, of course, they give you a disclaimer, we can't tell you because it's not a legal case. And then they give you an example of a case in court where the emerge doc didn't look at the chart and I guess misdiagnosed this patient's bowel obstruction. They were held legally liable when they didn't look back in the chart. I guess this is the most relevant case they found, which is good because nobody really got into trouble legally for not looking back to 1996 in Connecting Ontario yet. So they say that they emphasize the word reasonable. So they don't give you a judgment, but like they don't give you a recommendation of how far back you need to go. They don't do that. They specifically avoid doing that. But they just said use your judgment, be reasonable, and think about what your peers would do. And so this is their final conclusion. Sorry, it's very wordy. I was going to highlight this, but I didn't have time. Sorry. So essentially, the takeaway points is that 1, use your judgment to see how far back you need to go. I think for people who have a lot of data recently and there's good summary notes, you don't need to go all that way far back. But if they don't have a lot of notes recently and you want to, you want to see what they have far back, then you may want to do another search going back in time. And the second thing they say is that if you're having technical issues with Connecting Ontario, like I did this morning, then it may be wise to dictate that or to write that in your notes that you try to look at it, but it crashed or it didn't work or was buggy. And if you say that, then it's sort of a low protection. Now, obviously, this is not from like what's good for the patient. This is just from a legal perspective. So when the lawyers talk, they say like, if you're having technical issues, write it out so that if anything were to happen, there'd be some way of defending you. These are the 2 takeaway points. Side point, not really, usually relevant. I don't think anybody's going to get in trouble for this, but just in case you were wondering, that's what you can do. Any questions so far? No.
Eric, there is one question
Okay.
from someone who says, I'm interested in applying this method to a long-term care home.
Okay.
Is there someone I can connect with on doing this? Or can you comment on any cases you've seen?
Okay. So, so that's a good idea. I've never done onboarding for a long-term care home just because I don't work for them. Like, I would do consultations for them and I would have my own access. The way to do it is to go to that website. So on that eHealth Ontario website, there's a link to like guide you through onboarding. Usually what happens from before is you would send in a request and then somebody would get back to you in a few days or a few weeks. And then they would tell you that there's a long list of hospital and systems that need onboarding. So it's going to take another 4 to 6 weeks. And then they will, guide you through the process or they'll find the right person for you. But there's actually a team working from eHealth Ontario that actually does this. And so they're relatively responsive. You just go on that website, and if you scroll down, there's a link for like onboarding or like requesting access, and that's how you do it. I would have to look. I was in contact with somebody from eHealth, but that was a long time ago. I don't know who that person is now. So it'd be good to go on the website, or you can just call them if you have any questions. So that's what I would say.
Fantastic. So Ruth, thank you for your question. And that's it for now. So Eric, you can carry on with your presentation.
Yes, and I think Katrina said here that yes, not all those labs are connected. So I also, yeah, that's a good point. So usually most labs from outpatient labs are there, but on occasion, rarely, sometimes it's not. So yeah, again, like sometimes for some reason it's just not comprehensive. Has to do with the background systems that they work on. So the things that I point at. So I will now go back to. So wait, I have to like go back to this first. And then share screen. Okay, good, we're back. All right, so I'm just going to go through a few things, looking at the most helpful parts from Connecting Ontario. So we'll just, medication list, which I kind of go in order, look here. Okay, so if you want to look up medications, that's the button to click. Now you also see that in the main screen interface here, you also see this little box towards the left side where it gives you the meds. You can look here. I find that like if you just use this little interface on this main screen, it doesn't give you all the information, and you end up having to scroll, and it's just annoying. But if you click that medication button on the menu bar on the left side, it actually brings you to this screen. Now, this is a pop-up, and obviously I put boxes over it, but this pop-up actually gives you a pretty good list and a lot of details too. So you'll notice here on the left side that it gives you the dispensing date. So this is very helpful because you'll know when the last time this patient had medication dispensed. You can see the pattern as well. So if they get all the meds at the same time or at different times, then you get the drug name, the brand name, the dose, and then the formulation. You also get the quantity and the day supply. So and you also know what their pharmacy is, the prescriber, the person who prescribed it, and also their CPSO or the nurse practitioner number. So all of this information is actually really, really good for a geriatric consultation. So automatically you can probably guess who their family doctor is, because that person will be the one prescribing, or their nurse practitioner, like whoever's doing primary care for them, because they will be the one who are going to prescribe the most things, right? So you'll figure that out, and you also figure out their ID number, so like how to contact them, how to forward your own notes. You'll know their pharmacy. Now, if you click, we don't have the screen here, but if you click any one of these medications and then you scroll down, it actually gives you more details, including the phone number of the pharmacy, which is really helpful. In the day supply and the quantity, you can guess whether they're using a blister pack or they're having it in vials. And so here, because they're dispensing it in 90-day intervals, which probably didn't happen during COVID because they were restricting how much you could take out of the pharmacy. But like this tells you that they're probably in vials. So just looking at this, I can guess that this person's dispensing medications in vials or in bottles, and then they may be doing whatever to the dose set and stuff like that. If the day supply is in multiples of 7, so 7, 14, 21, 28, then it's more likely to be in a blister pack, because that's how the blister packs, they're weekly, right? So you can guess whether they're in a blister pack, even if you don't call the pharmacy, by looking at how it's dispensed. So, you can get a lot of information. Now, if you remember, stuff that's not covered by ODB is not here. So your baby aspirin, actually this person's using 325 aspirins. Some doctors do give the 325, the covered aspirin, and then cut it into like a third or 4/4 dose, and so to get 81 in the covered way. But most people, you have to buy your baby aspirin outside. So usually baby aspirin's not on this list here. Your vitamins would not be here. Your melatonin would not be here. B12 injection would be here, but not B12 tablets. So there are some limitations to this. Oh, and another thing that's really useful is you can actually search. Now, when you load this list, And if you go back 20 years, it's going to take a long time to load. It's just really, really slow. So for medications, like unless you're doing some detective work, sometimes I do because I want to figure out when they were diagnosed with dementia. I know that they're on donepezil, which is a dementia drug right now, but I want to know when they were started. So then I would have to adjust the dates and go way far back. If you just adjust the dates for medications, then it's a little bit better because it doesn't try to load all the rest of the information as well. It just loads the meds, but it still takes a long, long time. So if you do that, then you can just click this box up here and you can search like donepezil, and it'll just give you all the donepezil dispenses. And so then you can just scroll down and go and see like when it was started, when it was first dispensed. So that's usually helpful. Now, the other thing you can do is you can print, and I think I can't see here. You see there's also that printer icon right there. So the print is actually very helpful as well. When I do a new geriatric consultation in hospital, I will go to the screen and I will click the print button and just print the first 2 pages. And that usually covers the most recent medications. Of course, the most reliable way to do this, as you all know, is to call the pharmacy and have the pharmacy fax it over. The good thing about Connecting Ontario is that if they use multiple pharmacies, some people do, not recommended of course, but if they use multiple pharmacies, you get to know like whether they're doing that and which pharmacies they're going to. So I usually print out the first 2 pages, and sometimes if you need more, and that usually gives you their most recent medications. Okay. Good. So next, what are we doing next here? Oh, we're doing labs. So next is labs. So you can see here in the bottom right of the screen here, there's lab results. So you can just click through this, scroll through. Sometimes for something quick, like just their most recent like blood work, then you can just scroll through here and it'll have like sodium, potassium, like A1C, all this stuff. You can also search by the same result. You can search it and it'll give you, so say like you type in A1C, it'll give you just the A1Cs. You can sort it by the category of the blood work. I think COVID results are here as well, so you can do that. And then override consent. For some people have like privacy specifications. So, but if you want the bigger screen, you can click that lab, that flask icon on the left side in the menu bar, and then you bring up this screen which has all the labs. And so when you're on the screen, then it's just like medication. It gives you a lot more information, and it's really great that way. So you get to see like the results very clearly, and if there's any flags, the reference ranges, and the dates as well. So you get to see all this information. So as I said before, you can search, you can also print. Now the way to print it is using this little document icon under OLIS full report. So whatever lab you want, just click that icon, and what it'll do is it'll print out all the labs that were done with that batch. So say like they had like CBC, electrolytes, creatinine, lipid profile. So if you click that OLIS full report button, it'll give you a page that's printable, and you can print that out, and it will include like all of the labs that were done on the same day, on the same batch. And so that's really helpful for printing. You want to print out lab results, so you can do that from here. The other thing you can, oh, there it is. The other thing you can do is you can also use the flow sheet. So you can see here that in this menu bar here at the top, there's a flow sheet option, and the flow sheet option allows you to like see the medications in a grid or a table format like this. This is similar. I don't know if anybody of you are like family docs who have access to PS Suite. This is like, when you have that option, you can like view the lab table from PS Suite. This is like that, and it's very helpful. A little bit slow, but it's really good to see trends, right? You can see the trends here. See this patient. Patient has high sodium and high potassium. So you can see all that here. You can scroll down, and so this is pretty helpful. When we did the Connecting Ontario training with Ontario MD, they kind of said, "Oh, this is very nice," and they also said that you can click this graph. The graph option allows you to like plot out a fixed number of lab results. You can see like you could graph out the trend I admit I don't use this very much. I don't use the flow sheet. I don't use the graph. I just want to know what their latest results are. And if I need to know the trend, I'll just search that one. So if I want to know what their A1C was like going back, instead of waiting for the system to load this page, I'll just like type A1C, or I'll type B12, or I'll type calcium, and I'll just pull all the calciums, and then I know. But that's just what I do. But yes, officially the flow sheet's available. Okay, next is documents and notes. So documents and notes is this middle part right here. And so this is where you can get all the consultation notes, the discharge summaries, in some hospitals like UHN, they upload all of their inpatient, some of their inpatient notes as well, which can get very lengthy in terms of like the list of notes. And of course, some places don't upload any notes at all. So for those that do upload, you can read them here. So you notice on this interface, it's a little bit sparse in terms of details. You only know that it's a consult, there's a discharge summary, or there's an ED record. And you could click this document icon to bring it up, and the details will open up a window, but it doesn't actually give you more. So if you click this document, this page icon on the left menu bar here, it's going to bring you to an expanded documents page. An expanded documents page is very useful. So you can know where that report is from. So you know that it's from UHN, for example, or from St. Mike's, or from any other hospital. It'll tell you, and so that's really helpful. It already narrows down where that person has been, and when they were there, and also like which reports are from which place. So it's very helpful that way. In some places, they'll also have an authored by, so who dictated or who wrote that report, the names will be there. It's not consistently there. And you can do some searching. Now I have to say I don't usually use the search option in this document panel. I just like read it myself, but it's also there. I don't know how well it searches actually, but if other people do, then you can share. And when you need to expand, you click that document icon and it brings up a different window for you to see the results. And so this is obviously only a sample. Oops. Yeah, and you can just read the report there. You can also print the report by clicking Print Current tab, and it's helpful that way. Other things interesting that sometimes I will, sometimes if you need to look up like, so their MRN at a different hospital, sometimes that hospital will have their local MRN there, but sometimes not. So like the data on these reports is inconsistent. Depends, it varies from hospital to hospital. And sometimes the report may be a PDF. I think for people using an EMR system where they export the report as a scanned file or as a separate formatted PDF file, then they'll have another tab here where you can like read the PDF, but you can print a PDF too. All right, so next we have imaging. So now, because this timeline's in the way, you can't see the imaging section, but it's below. So obviously you need to click this bar here, and you like click it or scroll it down, and you'll see imaging will be like right here. It's this box in the middle. You can also access it by clicking the imaging icon in the left menu bar, which is this X-ray-like rib pattern, and then opening up their imaging profile. So again, with this expanded imaging window, you can see which organization or which hospital they were at when they got the scan. You could look at the report by clicking the report icon, or look at the images by clicking the images icon. You can also see what was done, the description of it. So this is helpful. I think for geriatrics, it's pretty helpful because you often want to know, whether they had a CT scan or MRI brain or, X-ray. So it's here. Now, usually all of the hospital images should be here. I think most of the GTA ones I've seen here. The reports from outside of hospital systems are more variable. I think oftentimes they may not be present. In some centers, they do upload it. They have an agreement to upload at least the document, like the report, but maybe not the images. Also of note, if the patient got the scan done at a hospital, but it's not reported yet, it doesn't come here. So it usually only ends up here once it's been reported. So there may be a delay, basically. If you want something urgent, you want to see, there may be a delay. So we've had this sometime at St. Mike's where the MRI was done, but it takes the neuroimaging radiologist a few days to read it because it's not a stat report. And so in that case, it won't be uploaded to Connecting Ontario right away. It may take a few days. But it's useful, to see the images and to see the reports here. So if you click the report, this is what you get. You get the essentially notation. You can, read it and see what was there. We didn't show the images. It's not one of the screenshots. And finally, we have this, multiple people in an icon. So this is actually the LIN, or the community care, home care referral window. And so the community window shows you the LIN referrals. And so for this, you can, so this is a long-term care placement file, but your home care referrals for PSW, for OT home safety, for physiotherapy, all of that stuff would be here. So you can just click the service detail button and it'll bring it up. So it'll tell you, how many visits per week and when it started or ended. So it'll have some details for what's going on with the LIN. So far, I haven't seen like a lot of details in like describing the care or the issues. Like, I think that stuff you still have to call the LIN and then ask the case manager. And yeah, are they waitlisted for long-term care? So yeah, you can get some LIN information from here. We use it regularly in clinic, where we want to see like how many hours they're getting of PSW service. Great. And then the final section here is other results. I don't know the history of this. I don't know why, there's some other results, but usually for other results, you're going to get stuff like cardiology and neurology, and specifically like EMG, EEG, echoes, ECGs. They're here. They're not always here. Like sometimes certain hospitals share and some hospitals don't. So don't assume this to be comprehensive. A lot of times it's not. But yeah, if you want to see the other sort of miscellaneous reports, they're here. Yeah. But it's just interesting that they classify. They just put a whole bunch of. Usually, this section is cardiology stuff. That's what I usually see here. But yeah, so if you want to see their echo, then you can see it here. Good. So how long do I usually spend looking? I would say like 5 to 10 minutes per patient. And obviously, if the case is more complex, then it may take longer. I may be looking a lot longer. When I'm at the long-term care homes, if there's not a lot of local notes at the long-term care sites, I will spend more time reading it. And whoever asked that question about long-term care, this is very helpful in long-term care. I find that those charts in long-term care often don't have all the up-to-date results, or even don't have the full set of results. And so you can be actually missing a lot by not seeing what's here. And I find that when I'm doing those long-term care consults, if I have Connecting Ontario, I can, come up with a lot more information, and it really helps me decide what to do with the patient. So yeah, I find it very helpful in that situation. So somebody asked about inter-RAI reports. We didn't get a screenshot, sorry about that. I don't find the reports overly helpful. The only pages that I find helpful are the last pages, the last two page. Sometimes they'll have the medication list, so that's helpful, but it's not the most accurate. So I would still cross-reference with the ODB list or the pharmacy list. And they may outline the issues, like the part where they actually type out notes about like their cognition or their mood. So that part I find helpful, how much assistance is needed. But the rest of the scoring on the inter-RAI, I don't find that helpful. And sometimes I find it's inaccurate. On occasion, I look at the rating and I look at the patient and I'm just like, wow, maybe they were different, a few months back, but like, I don't think that's the right rating. But anyway, that's just my take on it. Just me. But yeah, if if you do, the inter-ride reports are there under the documents section. So not under CCAC, but under the documents and notes, and you'll see the rides here. Yeah, and it gives you a PDF, and you can print it out. Yeah. What else can I do? Oh, so something that I do, especially now we do virtual in the long-term care homes. You know, we still have occasionally families who don't understand, why the patient has dementia and why they're, advanced disease. And so sometimes I bring up the neuroimaging and I just show them the images of their brain on MRI or CT. So this is good because you can actually see the images on Connecting Ontario. It launches another screen where you can just look at the images if you know how to interpret the images, obviously, and you can share it. If you're doing the Zoom. So sometimes I do that. And you can, so I look at, sometimes for the CT abdo pelvis, sometimes I'll look at the images myself on Connecting Ontario to see if they're constipated, because sometimes radiologists will not really care much about, fecal impaction, fecal loading. But, I've had reports where you look at the image and it's like, well, there's like a lot of poop. And they didn't mention anything about that in the report. So Connecting Ontario is also helpful for that. They can actually just see the images myself and look at it. Right? And obviously, yeah, I don't expect you guys to do this. Only if you know how to interpret the images would you do that. I know that for Dr. David Tangway, when I ask him a question, because I have a patient who I can't figure out in terms of the dementia, I give him the health card number and he looks it up on Connecting Ontario, and he can look at the neuroimaging, and he generally has some smart comment for me. So it's helpful that way for images if you know how to interpret them. All right, so we are done the formal portion of this. Okay timing. So we have time for questions.
That was excellent timing. Thank you. Thank you for your presentation. So practical, so many tips. There is one question here for you about the Clinical Connect platform. I'm not sure if you're familiar with that one. So Karine says that it seems to be quite similar to the Clinical Connect platform. What is the difference, and is there a benefit to having access to both?
Hang on a second. Oh, I think Charles. Okay, so I'm just going to, sorry, I can't actually see the questions when okay, there we go. Now I can actually see. So yes, so Clinical Connect. So Clinical Connect was what I used in Hamilton when I did my, medical school and internal medicine training there. So say hi to folks in Hamilton. So in that, they basically have their own system of Connecting Ontario. It's basically the same, but they just built it separately and they maintain it separately. Does it make sense? Not really, but that's just the way it is. I think some of the notes from Hamilton actually get uploaded into Connecting Ontario. It's just that with for the parts of Ontario towards the east side, you get Connecting Ontario, and for that southwestern region, you get Clinical Connect. But it really is the same thing. And if you're talking about the challenges of using it, it's the same issue. I remember as an SMR, I would, in the middle of the night, would look up Clinical Connect and just go through all the notes, and one by one, then it would crash, it would be slow, but it's the same. It's essentially the same thing. So yeah, you use it the same way.
Awesome. Thanks for clarifying. And I did paste a link to that in the chat in case people are curious. We also have a comment from Kay saying it would be helpful in future to have the frequency as well. For example, 2 tablets BID versus 1 tablet QID.
Yeah. So I wish it did that, right? So that's one of the limitations with the ODD records, is that they don't tell you how it's instructed to be administered, so you have to guess. It's a lot of guesswork with the medication, which is not the best thing. As a standard for our clinic patients, like we always call the pharmacy and just tell them to fax us the pharmacy list, and that list is more, it'll include stuff like that. But yeah, no, that's a limitation with Connecting Ontario.
Great. If there are any more questions specifically on Connecting Ontario, please do paste them in the chat. We have, okay, so we just have another one popped up saying from Karine, thank you. So it sounds like living in a central area and then having access to Clinical Connect and Connecting Ontario is necessary to get all the info. A lot of the patients I service go to London and Toronto.
Yeah. Yes. Yes. Exactly. Exactly. That's a good point. So it is helpful to get information when their patients are traveling back and forth. I would say when I was on internal medicine, I always wondered why there's no connected system, because back then Clinical Connect couldn't access any Toronto information, and so you know, a lot of people get sent to Toronto for specialized heart procedures or other surgical procedures, and you know, it's not uncommon, but for some reason they didn't talk back then. But yeah, but it is helpful, especially if people travel in between regions. And so you know, I make it just a habit now, just to always go in to check. Even if it crashes, I launch it. I try at least 3 times. Today I tried 5 times, but I give it a few times, even if it crashes, just because it's so useful. But do you do 3-way virtual visits with long-term care residents and who may not enter the home? Huh. I don't, I'm just thinking. The only Zoom consults with long-term care is when the family member's actually there visiting. I've not done it where they were at home and I connected them by Zoom. It would not, you know, it's obviously possible, but it hasn't been a setup that was done. So usually I talk to them, like the nurse practitioner at that home would have me on the laptop, and then they would talk into the laptop, and I would talk to them from the computer. But you know, that's a good point. I think that's a very helpful part. If you can use Zoom or virtual for this, it'd be very helpful.
Wonderful. So it does not look
Good
like
point.
we have any more questions. Let me
Thanks.
check. So Ruth says, thank you. This will be essential when long-term care is in outbreak and staff are short.
And I think
So,
Barb also put a comment here. Barb's done it before.
okay, great. Thank you, Barbara. Wonderful.
In Zoom, yeah, the Zoom.
In Zoom.
Yeah, so Zoom is very nice for this. I mean, I have to say, like, I use Zoom a lot now for all the long-term care stuff. I use Zoom, and it's very helpful. Like, you know, once you get used to it, it's very, very helpful.
Excellent. And a couple more comments from Ruth. Families can facilitate, and you can do this 3-way also using OTN invite as well. So wonderful. So looks like Ruth and Barbara will be connecting, so that's great. Um, so wonderful. And Barbara also says we should remind the audience that Connecting Ontario is only for clinical care, and it is not allowed to be used for quality improvement or research. So absolutely, that is a very important point to clarify. All right. Well, thank you again, Eric. This has been excellent. Please do click on that feedback survey. It is in the chat box. We'd love to hear what you thought of this webinar and what other topics you are interested in. And please keep an eye out also for our next series, which is on health equity. So part 1 is, are you accidentally ageist? And part 2 is about uncovering our diverse care environments. So you will receive some links to register for those shortly. So thank you, everyone. Thank you, Eric, and have happy holidays, everyone. Take care.
Thanks for having me.